Hello, everybody. I'm Dr. Shilpa, and I'm a pathologist by profession. So, I'm starting a short video series on pathological concepts. So, today is my first video on squamous cell carcinoma. So, what exactly is squamous cell carcinoma? Squamous cell carcinoma is a malignancy arising from the epidermal keratinocytes. So, where exactly do you see squamous cell carcinoma? We see it in sun exposed areas like scalp, ear, lip, nose, and eyelid. So here I have drawn the microscopy picture of well-differentiated squamous cell carcinoma. So based on the degree of differentiation and the amount of keratinization, we can divide them into well-differentiated, moderately differentiated, and poorly differentiated squamous cell carcinoma. So here we are discussing about well-differentiated squamous cell carcinoma. So what we are seeing here is the epidermis, which I have already labeled, and the dermis. And we can see that if atypical squamoid cells are invading into the underlying dermis, breaching the basement membrane. If there is no breach in the basement membrane, then they will be termed as squamous cell carcinoma in situ. But in this case, they have already breached the basement membrane and they are invading into the underlying dermis. So this is the portion where you're seeing that they are invading. And you can also see that these tumor cells are arranged in nests, sheaths, and islands in the underlying dermis. So, how are the individual cells? They are large, polygonal. So, you can see that I have labeled here. So, they are large, polygonal. And if you observe the cell, they have abundant eosinophilic cytoplasm, round to oval vesicular nucleus, and prominent nucleoli. And you can also see they have abundant individual cell keratinization, which is a specific feature of well-differentiated squamous cell carcinoma. Also, you can see that there are lot of keratin pearls. So these here are keratin pearls. Then whatever you see in between these two cells, they are prominent intercellular bridges. Prominent intercellular bridges. Also, we see this is a mitotic figure. So let me summarize all the features that we are seeing here. That is, there are large polygonal cells which are arranged in nests, islands, and sheaths. And these individual cells are large polygonal with abundant eosinophilic cytoplasm, round to oval vesicular nucleus, prominent nucleoli, and the features of well-differentiated carcinoma, that is abundant individual cell keratinization, prominent intercellular bridges, and keratin pearls. And what exactly we are seeing here? In the intervening dermis, we are seeing lymphocytic infiltrate. So when we see all such features, then the diagnosis will be well-differentiated squamous cell carcinoma. Thank you. Please keep watching this video series for various other pathological concepts.